So now we have with us a 17-year-old football player who just completed his high school football game, and he's experiencing some upper back pain after he was hit in the back. Can you describe what that pain feels like?
It hurts, and it's a sharp pain.
Great. So after we rule out a fracture or any sort of rotator cuff pathology, we can say that this is a dysfunction of the thoracic spine. And so today we're going to treat with muscle energy of that area. So the diagnosis of the thoracic spine and the ribs as well is something worth reading in your Nicholas book. The ribs are differentiated into 3 different mechanisms of motion, and the thoracic spine primarily prefers flexion, and we'll also talk in lecture about Fryette's rules. So whether it's flexion or extension, it will primarily fall rotation and side bending in the same direction. So I'll walk you through the steps as I diagnose this football player's thoracic spine dysfunction, and we will treat with muscle energy. As you recall, muscle energy is a direct technique, so we're going to take the segment of spine where it doesn't want to go, where it's a little bit painful. So directly into the dysfunction is where we're going to go. Go ahead and turn around, and your back is going to face the camera here. And cross your arms. It's important that we have the patient always cross their arms so that we can palpate a kind of same sort of feeling on every patient. So when I initially palpate the cervical and the thoracic lumbar spine, after I ask the patient to cross their arms, I'll start at the top, and with a broad touch, I'll go from their suboccipital region all the way down to their sacrum. And I'm palpating, and I feel to my touch that it feels more tense on this right side. And because he's telling me that the pain is on this right side of his upper back, that's where I'm going to focus. So some landmarks to talk about here. The spine of the scapula is where we can palpate T3. And then the base of the scapula is where we can palpate T7. So within what I'm feeling, I would say for this football player, it's in the region of T5. And there's subtle movements here. But this segment prefers, which means that there's less tension in this area that I'm palpating when we go into flexion. Rotation right, side bending right. Okay. So with muscle energy, it's a direct technique, and I just told you what that segment likes or prefers. So we're going to do the opposite. So flexion, side bending, and rotation right. We're going to move this segment into extension, side bending, and rotation left. So I'm going to incorporate breathing, and I'm going to monitor at this segment. Big deep breath in, and I'm extending him, rotating him left, side bending left. Deep breath out. Big deep breath in. Exaggerate the motion, extension, rotation, side bending. Good. Big deep breath in and out. Extension, rotation, side bending. Big deep breath in and out. Extension, rotation, side bending. And we're going to move back to neutral. I'm going to palpate down the area again to check my treatment. And to me, it feels less tense than it did previously. For the patient, it could take a couple days for them to experience true relief. It could take a couple treatments. I would typically give about 3 treatments before I would refer a patient to someone else or pursue extra workup. How do you feel?
Amazing.
Awesome. Okay, so the next one is upper cross syndrome. So this is you're a 40-year-old female.
Do you have any wigs? Do you really?
Can you go get it?
This is why I'm a producer. You have a wig. Why do you have a wig?
My friend's dressed up as D.
From yeah.
It's always sunny.
Sunny.
The Dublin one.
What's your name?
Stacy.
That sounds
I
right.
need to. It might mess up your hair. Is that okay?
I just got it done today. But that's okay.
Is the hypertonic scalenes, and those will attach right here at the clavicle.
Nope.
Right there.
They attach to the first rib and the second rib.
So I'm going to apply
Don't just ignore it. You can't help it.
to the first rib and the second rib. So
Start it over so we can cut this part out. Come on.